Democrats, to connect the idea of reforming healthcare, creating a single-payer system, with their new track of attacking the Democrats as being soft on communism. And the two of those things coming together, Republican political opportunism, along with an AMA that was totally against Truman's expansion of the number of doctors, came together to defeat that plan. Now, while this is going on, big business starts to take over healthcare insurance, because they began to see, insurance companies began to see that, wait a minute, there's actually money to be made because more and more Americans are starting to get health insurance. And more healthy Americans are starting to pay into these nonprofits, and they're never taking any money out because they're young, healthy, and employed. So why don't we get into the business? So now, in the late 1940s and 50s, you have private insurers starting to take over more and more, greater and greater percentage of the market. The unions then step into the picture. Unions reach their heyday of their ability to change policy and direct political policies and to win rights and benefits for their workers. So the unions start to pressure the government to change the laws so that they could begin to collectively bargain over benefits in health care. And the National Labor Relations Board in the 1950s grants them that power. So now the unions start to take over not only negotiations over workplace safety and wages, they take over benefits. Now, once you get the unions involved, now the unions have a vested interest in keeping the game going the way it's been played, not going for a single-payer system. So the unions begun to oppose single-payer, business starts to oppose single-payer, more and more Americans who are being covered through their jobs because of the tax benefits to the corporations, they start to oppose single-payer, and the issue doesn't get touched until the 1960s. And only then, when John F. Kennedy first proposes covering old people with single-payer, then the unions and the corporations and everybody with a vested interest says, you know what? That works for us. The fewer Americans that are actually going to cost something for their health care, who are shifted over to dependency on the federal government and are not a voting bloc that are going to actually bring young, employed, healthy people into single-payer system. We're in favor of a single-payer system. Let's remove that voting bloc. And so you actually had these large vested interest insurance corporations supporting Medicare. Doctors saw this as an opportunity too. There was a lot of resistance saying, wait a second, right? Now we got to sort of, we're going to have regulations on how much we can charge these elderly people. But then they started doing the math. If you have enough elderly people and you charge them at a certain rate, the math actually works out that you can make money. And they didn't realize how good it was going to be. Nobody did. Because as soon as Medicare and Medicaid got passed in 1965, health care prices and expenses in the United States skyrocketed. From that time forward, because you had now people who needed health care tremendously and essentially a blank check from the federal government just paying whatever the doctors demanded. So it all worked out quite nicely. And then in 1971, Ted Kennedy revives the national health care single-payer system. Now, as many of you probably know, Richard Nixon was freaked out about the Kennedys, and he hated Ted Kennedy. He feared that this guy was somehow going to come out of the woodwork and take his presidency away from him in 1972. The Kennedys would screw him again. So Nixon comes up with a brilliant plan. Instead of going for Ted Kennedy's single-payer system, why don't we go back to this HMO scheme? Keep it all private, but create the impression that we're actually reforming healthcare. And so he passes in 1973 the Health Maintenance Organization Act. And what this did was it mandated that every company in America that had 25 employees or more had to have an HMO. Once again, this seems, all right, great. You know, more people that get health care coverage, wonderful. But what it really was a sop to those private insurance companies that were getting into the game And we're now going to have captive businesses all around America who had to get HMO coverage. And so what we have from the 1973 on is an increase in the numbers of the percentage of the population that is covered, not only by HMOs, which started off as non-profit corporations, but as for-profit HMOs. In 1981, HMOs, for-profit HMOs, covered 12% of the healthcare market. By 1997, 65%. It's now up around 78% of the healthcare market. Right? Once again, right, it's easy to demonize AMA, Republicans, the private healthcare industry, but every step of the way, even the good guys are making mistakes and leading to this craziness right now where there are all these different groups, from corporations to small businesses to unions to doctors to people with their private health care coverage who are scared of the change. And so this is how we got here in a historical nutshell. Are there any questions? Yes?
Well, I've got a couple. One was also Clinton tried it, failed. I just want to mention that.
Yeah.
But what about the influences of AIDS and the development of high technology testing and whatever?
Absolutely. Well, this contributes to the skyrocketing costs that go along with it.
Yeah.
But we can't forget that, Great Britain deals with AIDS. France deals with AIDS. They have also high technology testing. And yet, per capita, we spend over twice as much per person, per American, as they do in France and Britain. So, yes, technology is certainly part of the reason why we're spending so much money, but I think that there are bigger systematic reasons.
The price is going up all over the world.